It's been this talk has certainly been encouraged for a while, but now I'm finally doing it. So thank you all for attending. So let's get right into it. So the first thing I think that I want to talk about that we actually have a word for called diagnostic overshadowing in trisomy 21 is something that I observed and experienced 40 years ago. And basically, it occurs where the clinician or caregiver attributes this person's symptoms or behaviors to the underlying condition, in this case, Down syndrome, without considering other causes. So I would experience that, in a way where, for example, a low thyroid back in the day, well, that's just what happens with Down syndrome individuals. Why would you treat it? Or low B12, well, that just happens. Or digestive issues, well, that's just what happens without actually treating it. Now, this, of course, this awareness is happening, is less prevalent, but certainly it's something that, with a bias or you have to be aware of before you can actually deal with it. So this is something, that I've observed that most caregivers and health professionals don't even know they have it. And again, in this talk, it'll be relevant to digestive issues attributed to trisomy 21 without understanding and resolving digestive problems and how important that can be to the brain and overall health, or even nutrients, how low nutrient status can affect the brain, as opposed to just attributing mental health and cognitive issues as being associated with trisomy 21. So let's just jump right into it. So the things I want to talk about today are three main biochemical targets to improve brain function in trisomy 21. And these are the areas that have the most evidence. So I don't want to spend a lot of time on thyroid because measuring thyroid function in children with trisomy 21 is part of the guidelines. I generally see it happening most of the time, where there's still exceptions where, in some areas where perhaps with practitioners who may only have one, down trisomy 21 individual in their practice, and they may not be aware of guidelines where I'm trying to bring this forward still, but it's still it's certainly not as common in terms of not testing as it used to be. But it's really important to note that the thyroid is really an optimal thyroid function, which is found more commonly in trisomy 21, actually can affect the brain quite significantly, and that's proven. And there's optimal levels of thyroid that should be used. A quick note is that the microbiome, which is now being proven to also have a significant influence on the development of autoimmune thyroid diseases. So it's interesting how all of these things that we're talking about today interact with each other. And of course, one other comment I'd like to make on thyroid before I move on is that the most common prescription for low thyroid is natural human T4 levothyroxine, which is Synthroid or L-troxin, which they actually do require conversion to active T3. Some more common than in a non-trisomy 21 population, where that conversion can be impaired for a number of reasons, and sometimes it's worth further investigation if when T4 levels are not optimal, or there's still symptoms of low thyroid. Now, diagnostic overshadowing with digestion in trisomy 21 is significant, and it's kind of and so what this means is that Down syndrome individuals have higher rates of digestive issues. such as irregular bowel movements, constipation, diarrhea, bloating, heartburn, and reflux. Bios occurs when these digestive issues are attributed to the Down syndrome without trying to resolve these issues or complete further assessment. So I don't think I need to explain that anymore. It's just like, why the heck wouldn't you try and figure out what it is, especially as we go further and understand how significant digestive issues are to the brain and overall health. So microbiome and digestion impact on health. So current evidence is that understanding digestion and microbiome is one of the most profound ways to influence human brain and overall human health. And I hope at the end of this presentation, want you to actually know more about this relationship, about the influence of digestion and microbiome than actually the majority of health professionals in my experience, and certainly more than 99.99% of the lay public. So just on its relationship to the brain, I did write a book recently on microbiome and the brain connection, and literally there's just so much information that the book was out of date by the time it was published. That's just how much information is coming out. I mean, I just quickly put a slide in ending in 2015 in another presentation I did, and you can see this explosion of information and studies on the microbiome, and literally it just, that curve just keeps going up and up with certainly over 1,000 studies a week. And the analogy I like to use is, 10 or 15 years ago there were used 3 studies. It's like drinking drips from a hose trying to get information to now there's just such an explosion of research. It'd be like trying to drink from a fire hydrant. There's that much information. So what is the microbiome? So the microbiome is essentially your poop. It's a 2 to 5 pound biomass of bacteria, fungus, viruses, whatever, that mainly reside in the large intestine of the gastrointestinal system. And there's certainly more bacteria there, more cells than there are cells in your whole human body. And that this has a tremendous impact on metabolism, detoxification, genetic expression, the immune system, and on and on and on. And certainly in that explosion of research, those thousands of studies per week, we're seeing this explosion of research into all of these different categories, and on and on and on. And again, it's beginning to give us a sense of what's going on. And of course, you can imagine when I practice clinically that people are sometimes very surprised that, well, what do you mean my kidneys related to my microbiome, or that 90% of skin inflammatory and skin issues are related to the microbiome, or you mean my diabetes can be resolved or improved dramatically with microbiome? So it's quite significant when you see people that have suffered with all these peripheral issues for decades, where when they resolve their microbiome issues, see significant, if not complete resolution of these issues, just simply because they've never understood that they're serious. They just thought that's the way they are, as opposed to understanding this primary digestive microbiome problem may have been the cause of their health issues. So the microbiome breakdown, so in your poop, there's 11 major genus of bacteria, and a genus is basically saying like the grass and the shrubs and the small trees and the mid-level trees and the canopy. So it's truly a rainforest of genus of bacteria in the microbiome. And what's kind of important to understand is that 9 of those genus are anaerobic, and only 2 are aerobic. And so the significance of that is that only if aerobic means that they can live in oxygen, and anaerobic means they die when exposed to oxygen. So of course, if you're going to buy a probiotic, it has to be kept in the fridge or kept in, outside the human body. And only two of the major genus, Lactobacillus and Bifidobacterium, can actually be put into a probiotic. And all the other 9 major genus cannot live outside the body. So that has significant roles in understanding that you actually have to feed them. You can't take them. So that's something we'll be coming to later on. And how do you feed them? These 9 major genus of bacteria that have proven in those thousands of studies per week major human benefits. So what is it? How do we start, which we'll get into? How do you grow them? Well, a hint is fiber. So how important are these things, this growing of these genus? Well, basically, this British Medical Journal study, meta-analysis, maybe looking at all the research, basically looked at 186 observational studies, 58 clinical studies, 135 million patient years, just kind of overwhelming number of patients they looked like, that basically said every 8 grams of soluble fiber reduce your risk of colorectal by 5 to 27%, reduce your risk of heart disease by 20-30%, reduce your risk of type 2 diabetes by about 30%. Essentially, what it was, really saying is that this fiber actually reduces your risk of dying of a heart attack and stroke, the 2 major killers of humans, by more than any drug or any other intervention, and in fact virtually eliminating colorectal cancer if you were to get to the guidelines. So the guidelines were in Canada and recommendations around the world were updated to reflect the influence of fiber on disease prevention. And then, I had some data that said in the UK, only 9% reach 30 grams daily. In the US, the average intake is 10 grams, Canada 14 grams of fiber daily. Every patient, of course, when I consult with them, I do a dietary survey. I have never met any Canadian yet who's come close to 14 grams in a day. So it's really, and I do believe I have a population with really good diets, but they're still not aware of it, and they're not close to this. This probably, and there may be a number of reasons for that, which we may not get into, but I think these numbers of how much people are actually getting are a bit inflated. So to summarize, fiber can virtually eliminate the #1 cancer, colorectal cancer, and of course the evidence is emerging that it has significant impact on reduction of hormonal-based cancers because estrogens are mainly metabolized in the microbiome, which is quite so. A healthy microbiome is how I treat women with PMS, endometriosis, hormonal imbalances. So improving the microbiome dramatically alters and improves hormone balance, which who would have thought, right? But that's proven, and I do that every day. Fiber reduces heart attack and stroke better than any other drug. Again, if as a clinical pharmacist, I'm actually going, well, holy cow, I can reduce blood pressure, I can give a statin drug, but fiber seems to work way better than it doesn't mean you don't do these things, but fiber has 20 to 30 times the power of it. Diabetes is a scourge. It has a dramatic impact on reduction of diabetes. This is kind of interesting in the explosion of the use of these GLP-1 drugs, right? Ozempic type drugs. fiber has a role in regulating and reducing weight, in fact, through the GLP-1 pathway. And of course, it's proven good for brain function, and virtually nobody gets enough or even close in my dietary reviews. And so what are the Canadian guidelines? 25 grams daily for women, 35 grams daily for men. And it's quite tricky. See, if we look at some of these things, right, we go, okay, one pear, 5 grams, an apple, 4 grams, carrots, 2 grams, broccoli, 2 grams, almonds, chia seeds, lots, and chia seeds, which we'll get to. But you can see that it's kind of hard to get it up to 35 grams for a man and 25 grams for a woman. Now, what is the thing that I see every day is the kind of the scourge of a good diet. So obviously, if fiber has such an overwhelmingly proven dramatic impact on the major diseases that kill us and our brains, so when I say a good diet, we should actually know what that means, especially related to fiber. So I eat a good diet does not necessarily equal adequate fiber intake, right? We already know that most people get a fraction of what's been recommended. And I also have observed that if a doctor tells you, you can get everything in your diet, I've actually very rarely, only maybe one case in 40 years where I've actually seen a health professional ask people what they'd eat. And I'm not aware of any health professional that other than nutritionists who be aware of the doing a fiber review of a diet. So eating a good diet may mean you have an average diet, but it certainly doesn't equal adequate fiber intake. Now, this is kind of important because of the notion of fiber soluble versus insoluble. For what we're still taught in my recent, to maintain my prescribing license, I had to do a course on drugs for the digestive system. And they're still teaching today that fiber goes in one end in your mouth and out the other end intact as a mass, right? Like what you eat in your mouth, you poop out in your stool. Now that is what insoluble fiber does. Essentially, insoluble is like some kinds of seeds or whatever. You put it in glass, they clunk to the bottom, and you poop out what you take in, right? And this can be, different substances. Mainly, the classic is seeds that may go in one end and out the other, undigested. Now, soluble fibers are generally are sugars that dissolve readily in water. They feed actually gut bacteria. So really what soluble fiber are prebiotics that actually feed and are superfoods for those genus of bacteria we've been talking about, right? And they have profound impact on metabolic function, right? Blood sugar, lowering cholesterol, liver health. Even we're still taught that, fiber binds cholesterol in the bowel and you poop it out. No, soluble fiber actually creates tremendous metabolic activity. It takes pressure off the liver, it detoxifies, and it upregulates all the functions of the liver that allow you to handle cholesterol better. And even then, so when we talk about solubles, this slide talks about psyllium. Psyllium is a mixed fiber of insoluble and soluble. Oats are mixed. Again, so it's tricky, right? So we need those soluble fibers to grow the microbiome. Now, soluble fiber are basically sugars or different chemicals that power up the microbiome, that are superfood for the bacteria in your large bowel. And there's basically three kinds of different uh, sugars that only bacteria in your large intestine can use. The beta glucan sugars, and really what it means is sugars that you can't digest, but bacteria love. They just love it. So beta glucan sugars, resistant starches like green panade, which are found in green bananas, plantains, cold potatoes, and the polyphenolics, blueberries, citrus fruit skins, green teas, quercetins. Again, the evidence is emerging. You know how we always thought, blueberries and kind of the extracts of red wine and green teas and all these things were so good in our bodies. The evidence is emerging that these things have these tremendous health benefits through what they grow in our microbiome. So that's so fascinating, isn't it? Based on the overwhelming amount of evidence and trying to grow the most number of genus of bacteria, I actually designed a prebiotic fiber that contains all three in significant and proven doses. So what we're trying to do is use the most evidence of certain types of polyphenolics and resistant starches, which I love resistant starches. They grow a lot more of these genus and some of these other more widely available beta glucan sugars. So the best soluble fiber would be something like a GI manager. And what I'm trying to do is power up the number of fruits and vegetables equivalents to bring you way over the top in terms of enhancing dramatically the microbiome in the most number of the genuses. So that's this GI manager prebiotic fiber that I designed. So just to restate this soluble fiber are superfoods for the microbiome. There's those 11 major genus. I can only give a probiotic generally with two of them, 2 of 11, right? So all the rest, all the other 9, you have to grow them with prebiotics, fiber or soluble fiber probiotics. You have to grow them right in the body. And those superfoods found in fruits and vegetables and some whole grains are incredibly crucial to growing those things. And they have the most evidence for human benefits. That's just the state of what is proven to be true. And if you're not in that space, you should be or you will be. That's just a question of timing, and hopefully maybe you're 10, in my experience over the 40 years is that sometimes medicine is some of the slowest to kind of accept overwhelming data. Now, with this talk, I can get a little more specific to trisomy 21 and some of the issues that may be found in trisomy 21. So in a sense, sometimes if you were to just take more soluble fiber or sugars even, digestive problems or other issues can be made worse. So what if soluble fibers, certain fruits or vegetables were intolerant to an individual with trisomy 21. What does that mean? And that can happen more frequently in the trisomy 21 population than the non-trisomy 21 population. So what does that mean? Does that mean that that individual cannot get the benefits of soluble fiber in the microbiome, which is, right, the large intestine? Well, the answer is no. It actually uncovers something that may be really important and really significant to overall brain health and overall health in that individual. So to do that, we need a quick digestive course because, again, health professionals still somehow think that, it's one big tube from your mouth to your anus. But for our purposes, there's two very distinct organs, the small intestine and the large intestine. The analogy I use, I call it the kitchen sink analogy, is like your kitchen sink is like the small intestine. You clean your food, you cut it up and break it down into small pieces. You eat the good stuff that you can digest, and the stuff that you can't digest, you flush it down a carburetor, for example, into the septic bed, which is outside the house where there's trillions of bacteria, when that's like your large intestine, right? So what if, right? What if the kitchen sink now wasn't emptying very well? In the human body, that carburetor, that emptying of the sink, occurs every 90 minutes, night and day. 90 minutes, it goes brrr, empties into the septic bed. It's so important, right? Just like your kitchen sink. Can you imagine if your kitchen sink wasn't emptying? It would get, or very delayed in emptying, it would get gross very fast, right? You'd start growing all kinds of weird stuff. And that's exactly what can happen, right? So all of a sudden, the kitchen sink is functionally, the carburetor isn't working very well. Of course, you can start getting some delays in in that emptying, causing some growth of some weird stuff that may be all perfect in the septic bed or the large intestine, but certainly not good growing in the kitchen sink. So that's where we get into something that again should be well known, but it is not. The issue of structural versus functional issues in the digestive system. So often we see so many people in trisomy 21, but in the general population, a high percentage of people actually diagnosed with IBS, or irritable bowel syndrome, which really has no meaning, but really what it actually means is that they have a slow emptying of the small intestine, right? Think of my analogy. You get delayed emptying, and of course you can get constipation, you can get bloating, you can get reflux, you can get burping, diarrhea, nausea. You can get all kinds of digestive issues if that kitchen sink is slow. You have to medically rule out structural issues, right? You got to make sure there's no strictures or blockages or cancer or some kind of herniation, which does occur more commonly in trisomy 21. But once you rule out these structural issues, then IBS is simply a functional issue, a delayed emptying of the kitchen sink. And of course, if that happens, and if you put fibre, which is sugar the bacteria love, and you put that into your kitchen sink, that may cause you to grow more bugs in the kitchen sink. It doesn't, because that soluble fiber prebiotic is not being flushed into the septic bed. Do you see how important it is to just have a basic understanding of the digestive system? Because symptoms of not being able to handle a product like GI Manager may actually, or certain sugars, or certain fruits or vegetables may simply be uncovering a really important functional issue of the small intestine, which we will see are very significant health implications. So that delayed emptying or dysfunction or IBS or whatever you wish to call it of the small intestine has proven, remember in those thousands of studies, has these proven relationships to other health conditions, cognitive dysfunction, anxiety, depression, and skin problems, autoimmune disorders. Most of your immune system resides in the small intestine. Liver and kidney issues, more fatty livers. So if the kitchen sink is overflowing into your house, your liver and kidney have to do that work. That liver kidney work, high energy, sucks the energy out of you, versus free energy if all that material gets into the septic bed. Micronutrient depletions, that's where you absorb all your nutrients. Iron, B12, vitamin D, calcium, magnesium, folic acid, zinc, all that absorption occurs in the small intestine, which is the kitchen sink. If you have this overgrowth and dysfunction, you start getting micronutrient problems. Thyroid disease, right? Autoimmune. Down syndrome regression disorder. So this small intestine can trigger serious inflammation in the brain, right? An acute regression, which we'll talk about. More food intolerances, sensitivities, and allergies. Individuals with functional issues in the small intestine will always have more sensitivity generally to gluten. So that's significant, right? And to soluble fiber in some fruits or vegetables. And then weight problems, that can be related to this as well, right? And diabetes, prediabetes, and so on. And again, there's a diet called the low FODMAP diet, which is actually a bunch of different sugars that bacteria love. If you have a good response to a low FODMAP diet, we mean reducing certain dietary sugars, that generally means that you have a functional issue in the small intestine. This one study in 2014, they just went into a gastroenterology clinic and just gave them depression and anxiety score questionnaires. And so in 5,000 patients in this clinic with functional issues in a digestive system, 90% had scored high anxiety and 87% qualified for clinical depression. So the conclusion of the authors is like, hello, why aren't we making this connection? There is a condition in Down syndrome called Down syndrome regressive syndrome, where individuals rapid and dramatically decline from previous levels of function, perhaps from cognitive, from verbal to nonverbal, social to non-social, continent to incontinent, gentle to aggressive. So there's certainly over the years many reports of significant, in individuals from teens to early 20s, a significant and dramatic regression. And we actually gave this a name, Down syndrome regression syndrome. Now, in a recent case, as we know, there's this link based on the other information I've given you, knowing that there's a link between small intestinal disruption and functional issues and the brain. I have a recent case with a young male with trisomy 21 diagnosed with Down syndrome, regressive syndrome, basically a functioning, healthy, social individual to a bedridden individual who virtually had to be transported to medical appointments where the treatment for this condition is classically antidepressants and steroids. Um, and in my assessment, this individual had severe digestive issues. In fact, SIBO, which is small intestinal bacterial overgrowth, so a significant overgrowth of bacteria in his small intestine, but with no structural issues like cancer or whatever that had been ruled out. So my treatment was to treat the SIBO and to re-support the small intestine and get this functioning again with prokinetic agents to get it going. Magnesium is glycinate is a beautiful prokinetic. Antibacterial probiotics and herbs break down the biofilms that create this trouble in small amounts of the GI manager prebiotics, just small amounts. You can't give a lot. You have to just kind of tease out this and stimulate this gently. And after 2 months, dramatic improvement. There was a dramatic improvement of the gastrointestinal problems, and the mother reports that she has her son back. So it's quite dramatic, especially in light of the existing treatments versus the use of antidepressants and steroids, which are certainly not going to deal with any relationship to the digestive system. Now, of course, historically, I like to always talk about nutrients in trisomy 21, but this has always been a classic case of diagnostic overshadowing, where cognitive issues are proven to be associated with trisomy 21, and if you if you treat them or suggest that nutrients may improve the brain, then you're of course not accepting the underlying condition, or you're somehow offering some type of alternative therapy. Again, so nutrients have been shown to be low in trisomy 21, but they're also very interesting. Those same nutrients that we're talking about have been proven to be crucial for digestion and brain, right? So the digestive system and brain very much need the same nutrients. Low in magnesium, choline, iron, vitamin D, B12, folate, zinc. Oxidative stress is higher in trisomy 21, increasing requirements for and support for antioxidant systems, vitamin C, E, glutathione, carotenoids, coenzyme Q10. The thyroid is lower in trisomy 21, which needs zinc, selenium, iodine support. So all that stuff is all true. Nutrients have been proven to improve the IQ in non-trisomy 21 kids in multiple placebo-controlled trials and studies using standard IQ tests in trisomy 21, so have proven to be useless for a number of very obvious reasons. So classic IQ tests in trisomy 21 kids are not helpful or useless. And any study using these standardized tests should not be considered. That's just proven to be true. But in spite of that notion that we still persist that nutrients, even though they've been proven to be helpful for the digestive system, for the brain, and in non-trisomy 21 kids, they somehow almost have a negative connotation that they're not helpful for trisomy 21 kids, and based on studies that have completely and totally flawed assessment tools. So I would consider this classic diagnostic overshadowing, right? The underlying condition is the issue. Any other intervention is trying to not deal, is to pretend that you don't understand there's an underlying issue, which is just false. So why are micronutrient levels often suboptimal? Again, we have, even in the case of fiber, right? Most people, pro health professionals, and the public aren't aware of what a good diet means in terms of fiber intake, higher levels of gluten sensitivity and celiac disease. Again, gluten sensitivity makes much more sense now for me when you understand the gluten slows the function of the small intestine, which can compromise people that already have existing issues, higher levels of those digestive issues, microbiome dysfunction, which occurs more frequently, of course, the genetic influences, higher levels of oxidative stress, and sometimes I deal with all the time in my consultation numbers of different antibiotics and drugs such as proton pump inhibitors, which are prescribed like candy, which which interfere with 100% of the function of the small intestine, and yet they're handed out routinely as sort of maintenance drugs. So that's another whole discussion. In conclusion, just to not overwhelm everyone, so basically, if what I recommend is that without being too sophisticated, you can do a lot, to support cognition, brain, and overall health in trisomy 21, and of course in every person, right? But specifically in trisomy 21, you would always at least follow guidelines with thyroid function. Do blood work on an annual basis. Make sure the TSH is below 3. For the microbiome, solve and optimize digestive function. Increase fiber intake according to guidelines. Be aware of guidelines, and perhaps use soluble fibers such as GI Manager which is this comprehensive soluble fiber that hits the most number of the genus of the healthy microbiome. And then for micronutrients, optimize microbiome and digestion, right? I did all these papers on iron digestion and iron absorption, and did this work on iron at the University of Toronto. And I thought I was really smart with respect to iron, and I designed irons that were absorbed better than any other irons. And now I realize, oh, if you have chronically low iron, it just means you have a small intestinal problem. And now when I resolve small intestinal issues, iron levels dramatically jump up. You see what I mean? It's like, oh, it was hiding in plain sight where the problem was. And so many people say, well, I can't absorb iron, or I have to take high doses of iron, without recognizing that's a major symptom of small intestinal dysfunction, and that improving that small intestinal function will dramatically increase nutrient absorption with virtually any iron or virtually any product. So it's quite interesting how, as you understand digestion, small intestinal function, how so many things make sense, why you had to give more nutrient to one person versus another, just based on their digestive system. So again, taking MSB multivitamins would be an obvious thing just to ensure, as any multi-nutrient, to ensure optimal levels of nutrients for the brain. Now, if you want to be more advanced, working and there's digestive issues, or you want to have a more optimal and more precise understanding of what's going on in your body, or as an individual with trisomy 21 body, you would do more work, right? And you would do more blood work. You do assess the thyroid, of course, micronutrient status. Liver function gives you a picture of sometimes what's going on in the small intestine. Same as B12. Sometimes B12 can elevate, or ferritin can elevate if the liver is inflamed, often pointing to the small intestine. Blood sugar status, electrolytes, kidney function, adrenal function. So getting a picture of your starting point. And then, of course, the digestive system assessment, right? Often, the symptoms tell you what's going on: gas, bloating, constipation, diarrhea, making sure that there's no structural issues. Usually, most people, by the time they've seen me, they've ruled out, structural problems, pharmacotherapy impact. And I love the microbiome stool test, right? So you're starting to assess with the poop, the quality and type of what's going on in the microbiome. Now with your poop, you can't tell necessarily what's going on 20 feet higher, but you can start to get a clue. For example, if there's low pancreatic output, because commonly in trisomy 21, there's low digestive juices put out. So that you can get that from a stool test. You can get any of the other you can certainly see any pathogens. You can certainly see certain bacteria are more prevalent in the stool if they are coming from the upper intestine. So you can start to look around and see in the stool what's happening up higher. And if an individual can do it and there's digestive issues, there's a breath test for SIBO, or function of the small intestine, where you're literally giving sugars that only bacteria can digest and seeing if they are being excreted in breath, and you can tell the type and severity of bacteria coming, in the small intestine that shouldn't be there. Remember, the kitchen sink isn't sterile, but it shouldn't be growing all kinds of weird stuff in your kitchen sink. And of course, with all that information, even genetics, you can do more genetic work. But again, it's interesting that as time evolves, just as I mentioned the iron issue, understanding digestion and microbiome will have more profound impact than understanding the other layers of genetics versus microbiome. It's just a question of what would I do if I was to do anything. I would always enhance microbiome and digestive system. And of course, we can customize MSB vitamins, and of course, we can get more specific to improving the microbiome and small intestinal function on an individual basis once we have all this information. So in summary, I hope that's a lot of information, but it's really quite a summary of where, after 40 years of work, of how much we know and how much how we understand, how you can, optimize human health. And it's quite an exciting time. I just find that the world of the microbiome and the understanding the relationships and how everything was just always hiding in plain sight is sort of very, it keeps me going and it keeps me excited to always continue to be able to help people. So, hopefully you can see the how diagnostic overshadowing has always played a role in trisomy 21, both for caregivers and health professionals, and the crucial role of thyroid, optimal microbiome and digestive system, and the role of micronutrients in cognition and brain health. And so I conclude, and if there's any questions, we'll go from there.
Just hop over to the next slide, Kent. Perfect. Awesome. Thank you very much. That was awesome, Kent. Learned a lot, even though I obviously was part of the making of the slides. So I'm going to go through some questions here from the chat box. And then also that QR code, if you're interested in any of the products that Kent has discussed, they will link into a collection specifically for the webinar as well. Okay, so Kent, the first question I'm going to ask, I'm going to lump a couple and I'm going to stick mainly with the gut microbiome related questions. Now, there was a couple questions that were related to unhealthy growth or parasitic growth, maybe kind of pathogen bacteria, things like that. So unhealthy growth, what about unhealthy growth of parasites? We struggle with that and it sparks hair loss. And another question was related to antibacterial probiotics. So maybe with the growth of pathogens like parasites or dysbiosis in the gut, how can we kind of work on that?
Was there a question on that somewhere?
Yes, there was two questions there. So if someone has bacterial overgrowth, right, parasites in the gut, or kind of like any sort of like a, dysbiosis, how can we work on that?
So the first, there's two issues in the microbiome. The first issue is that the analogy I use is like the lawn, right? It's normal to have weeds in your lawn. In fact, if you don't have some weeds in your lawn, you're that's kind of weird, you know what I mean? What's going on? Why don't you have some weeds in your lawn? The issue with weeds in the lawn becomes when there's no healthy grass and the weeds start taking over the biological system. Certain pathogens, just like parasites, just shouldn't be there. So if someone is saying, because they're quite nasty, so when someone says, I have parasites, you would certainly be doing a stool test to identify the type and severity of parasite. On the other hand, a healthy microbiome will not necessarily kill the parasite, but it may mitigate the symptoms and the issues related to any unhealthy bugs. So again, if someone claims to have a parasite, then I would actually identify the parasite in a classic test and do a microbiome test to determine the health and quality of the microbiome so that you can A, kill the parasite, which shouldn't be there, and B, have the microbiome recover so that it's in a very healthy, optimal state. So again, I do get people claiming parasites and fungal overgrowth and all this. And again, in the microbiome, which is a large intestine, it is normal to have some fungus or often some pathogenic bacteria like weeds. It is very normal and non-disease causing. On the other hand, if you get fungal infiltration up into the small intestine and it starts where it can be very dysfunctional, interfering with emptying and so on. So you have to differentiate between where the problem is. So a small intestinal bacterial overgrowth, even bacteria that should be are normally healthy in the large intestine, shouldn't be in the kitchen sink. Going to my analogy, the kitchen sink is those bugs in the kitchen sink are fine in the septic bed, but they shouldn't be growing in the sink. But there could be fungus or parasites or something there. Very rarely, but that could happen. But again, you have to be more precise as to where the infection is, what is it, and then is it a small intestinal problem? Many people with small intestinal problems actually and claim to have parasites or fungus or whatever, they don't know that they have a small intestinal issue, so and no one's told them or assessed it, so they wind up telling everyone they have a parasite or a fungus or something, but the reality is they have a small intestinal problem that's never been addressed, causing constipation, diarrhea, bloating, reflux, and all these things. So often it's just lack of precision.
Yeah. Yeah. Okay. Now, a couple questions related to fiber intake and constipation. My daughter's fluid intake is very low, so GI system is slow and constipation is a problem. Can GI manager be added to applesauce? Does it have to be in a drink? And kind of as a follow-up to that, um, you know, basically for what you had said, can fiber sometimes make it worse? Maybe some suggestions on how you might dose it.
Well, again, I hope I emphasize that that fiber can never make a large intestine worse. So soluble fiber will regulate the large intestine. It'll make constipation normal. It'll make diarrhea normal. It powers up the liver. There's nothing with soluble fiber in the large intestine unless there's some inflammatory process in place, but there's nothing that soluble fiber will ever do to make things worse in the large intestine. So it brings stool to the middle. It always regulates, it always makes the large intestine healthier. It eliminates colorectal cancer. It eliminates, diverticuli. It's so effective for so many things. Now, if there's delayed emptying of the small intestine, and you start, remember my kitchen sink analogy, there's bacteria in the kitchen sink and you start pouring soluble fiber into it, you could get more constipation, more bloating. Literally, bacteria growing in the small intestine can make things worse. So, and if you start feeding them, it can make more bloating, constipation, or diarrhea, or mix. So, so it's almost a little bit of a test. A GI manager doesn't make things better. You probably have a small intestinal delayed emptying. And again, that's where the improvements in the function of the small intestine will have big benefits to overall health, including, I'm just showing you how one example of how dramatic inflammation of the small intestine triggered inflammation in the brain and regression syndrome. So you can start slow with GI Manager, but if it ever starts to make things worse, I would recommend a consultation to solve the problem, which can have tremendous overall health benefits.
Yeah, awesome. Okay. There's another question. So also, if you have questions, try and put them in the Q&A box. We'll be trying to kind of shift from there. Can you speak specifically to your mention of oxidative stress in kids with trisomy 21? How does that play into the gut-brain connection and microbiome?
Yeah, I published actually one of the first in vivo studies showing that oxidative stress is higher in kids with Down syndrome than control children, their siblings. We thought back in the day that, just simply, if oxidative stress, which basically means we thought that giving more antioxidants, improving glutathione would make a big difference. Here's the reality. The reality is in people with enhanced oxidative stress, and you could be a smoker and increase oxidative stress, is that your oxidative stress genes upregulate. So they can upregulate and compensate for excess oxidative stress. Certain individuals have compromised genes, and this is significant. So if they were a smoker, their risk of getting cancer would go through the roof, whereas everybody else's genes would be able to upregulate. So in trisomy 21, we observed that we got more genetic research that you could see the antioxidant genes upregulate, and that the impact of antioxidant nutrients really were significant only in those individuals that couldn't upregulate the genes because they had their own genetic variations up and above trisomy 21. So the issue is that certainly, unless you do genetic work, which not everyone does, antioxidants may not be the ideal that we have, but it's that on the other hand, you should still give support for those antioxidant systems, because you don't know the other genes in trisomy 21 individuals. So now, how does this relate? Well, what happens is the liver is upregulated, the detox systems are upregulated. So all these other systems in a trisomy 21 individual are, including the liver, are working extra with managing these systems, and the microbiome takes unbelievable amount of pressure off the liver and detox and metabolic systems. Literally, every bacteria has its own liver and metabolic system. So it has tremendous impact on detoxification, metabolism, and allowing other organs like the liver, which is a really important organ, to upregulate and to handle excess oxidative stress. So that's pretty cool that the microbiome can take. So it's like a free organ taking all this pressure off other systems that are working extra hard to handle the extra chromosomes. So that's so cool.
Yeah.
How nature is so smart.
Yeah, absolutely. Just a couple last questions that have come in. There's been one specifically about an antibiotic probiotic that you had mentioned. So maybe can you speak a little bit about the probiotic that you discussed?
So in small intestinal dysfunction, so there's one that I use a lot that has a lot of evidence for its use in small intestinal issues, and in fact in large intestinal issues. It's Saccharomyces boulardii, and Saccharomyces boulardii is almost I don't even like the word probiotic, because it's more of a fungus that breaks up biofilms. So any pathogen or disease-causing bug grows in films. It's like weeds on your lawn that grow together, so you can't just pull one weed out. They grow in a big sheet. And Saccharomyces boulardii, even in the small intestine, breaks up bacteria that allows you to flush it out. And it's actually helpful for any pathogen or that actually grows in films, which virtually everything does. So so we call it a probiotic, but it doesn't it's not really a part of the human microbiome, but it has tremendous role in therapeutically dealing with any unhealthy bacterial or fungal infection. Saccharomyces boulardii, super effective. Yes.
Sorry, Kent, can you move your head a little bit to the left? Some people are trying to scan the QR code and they're not able to. No, the wrong way, the other way. There.
All right. Yeah,
Okay.
Saccharomyces boulardii.
Perfect.
Beautiful. I love
Yeah.
Saccharomyces boulardii is like a really and Saccharomyces boulardii, in fact, in young kids with Down syndrome, I use a little bit of magnesium, Saccharomyces boulardii, all approved in kids. A little bit of a stimulant called iberogast. So you can do some very gentle things that are very effective to get things going in and some of these individuals are very naive, meaning no one's done any of the right stuff. So sometimes
Mhm.
a bit of gentle stimulant of the small intestine can make a big difference.
Yeah, that's exactly kind of, I think this will be our last question. I've been trying to answer some questions in the chat too, but basically, you talked about Saccharomyces boulardii as well, but if someone is noticing small intestinal, like so delayed emptying, are there any other agents that you would recommend? So they said fasting, probiotics, eliminate or reduce liquids.
Delayed emptying, you would always, so again, any delayed emptying, generally during treatment, they will be more or less sensitive to gluten, which is interesting, right? It's so you may not have celiac disease, but they may be sensitive to gluten. Saccharomyces boulardii, magnesium glycinate stimulates as well. And like a wonderful product, which is super safe to even be tried, which stimulates pancreatic juice and the emptying of the small intestine is called iberogast. It's kind of like a liquid that we use because it's like 1,000 studies. It makes the small intestine work. It's more like it's based on the concept of bitters, stimulating the small intestine. Ginger, of course, is a classic stimulant of the small intestine, but the product, like a classic, just starting gentle stimulant of small intestine, would be like GI Manager, a small amount, Iberogast as directed, and Saccharomyces boulardii. That's kind of with some magnesium. All that stuff is very targeted to the small intestine at those kinds of doses.
Yeah, exactly. So you're talking about those prokinetic agents that support the migrating motor complex and kind of help
Yeah,
help that help that sink and those drains get moving,
that's
basically.
yeah, give it a little carburetor stimulant.
Yeah.
And think of it too, right? Most of the world is dealing with IBS. And what is it? And they go, "Oh, thank you for the diagnosis." Well, what
Hmm.
do I do about it? Well, I don't know.
Yeah.
Live with it. It's
Yeah.
crazy, right? People are suffering and they're not aware of the relationship between IBS and other systems. They don't have their microbiome is compromised. They get diagnoses of Paris. They think on their own they have parasites or something else without any evidence. You see, you go down these black rabbit holes and you don't know, but meanwhile, just basic, your kitchen sink isn't operating. Why don't you do some cleanup? Some people need specific types of antibiotics or products that clean up the type of bacteria or fungus that they've grown in their kitchen sink. It does get a little more involved depending on the type and severity.
Mhm.
So many trisomy 21 kids have not, may just need a little stimulant, especially younger kids. They don't need a lot, but some of the older individuals who've had this stuff going on for years, and imagine some people again have had this in, decades. Imagine being suffering for decades and then I've done a little bit of, sometimes they're resistant, sometimes a little bit of what I'm saying is enough to resolve their issues because they've never had anything targeted to the right area. It's actually very
Hmm.
sad.
Hmm.
number of people that suffer and they've been treated for all these other peripheral issues without actually dealing with their digestive system. It's really, it's quite, that's an epidemic, right, of digestive problems
Mm-hmm.
creating other problems.
Yeah, absolutely. We had a comment in the chat as well saying most professionals I've met that do this, I feel like I get emotional in the face of diagnostic overshadowing. I need a sentence that I can just have on repeat to the medical professional. So it definitely seems like this is something that is a kind of shared experience, and there are a lot of kind of digestive concerns that we're seeing kind of coming up more and more frequently.
Yeah, I'm glad we put a name to diagnostic overshadowing. Before, I just used to be
Mm-hmm.
mesmerized going, what are you saying? You know,
Yeah,
the child is low in B12 and I'm being B12 and you're turning this into some other kind of ethical issue. I'm
yeah,
always
yeah,
confused by the whole notion that, well, yeah, why wouldn't you just treat
yeah,
that individual like how you would treat anyone and with a diagnosis of Down syndrome. I never really understood it, and finally we put a
yeah,
name to it.
yeah. Last question, because we've got a couple requests for this one. So thyroid problems that prescribe someone has been prescribed levothyroxine, can they be solved, or is it a lifetime of taking medications?
Well, the first thing to emphasize is always take the medication, always, because it's just supporting. Levothyroxine is just some additional human thyroid support, right? So make sure, in fact, that the TSH, thyroid stimulating hormone, is always below 3. So first of all, if you're using levothyroxine, look at your blood test and see that the TSH is below 3, like 1 or 2, right? Then if still there's maybe digestive issues still, because the thyroid is very crucial for stimulating, guess what? The small intestine, right? See, so many. And if there's still persistent digestive issues with thyroid or brain or some other issues that look like low thyroid, even though you're on levothyroxine, you might do a little further investigation to see if it's being metabolized. And those individuals may need some extra T3, some active hormone to kind of get better results. So you kind of always use T4 and maybe add a little of the active if
Mhm.
there's some conversion issues, which you can check by doing a reverse T3 test. But always check now, I don't think could you get someone off thyroid? I wouldn't even think of it because to me it's like
Mhm.
just a little thyroid support and then you're optimizing it. Do you know what I mean? It's
Mhm.
one side. Now,
Yeah.
before there's certainly some studies that autoimmune thyroiditis and low zinc have actually improved thyroid function. But again, unless you're doing, you're really absolutely certain that the thyroid is optimal, that is really proven to me. The brain is and the digestive system is so sensitive to thyroid that I wouldn't
Yeah.
remove it unless you're absolutely sure the underlying issue is like that is good. And even then, I've never been able to get TSH suppressed. Like when you suppress the thyroid is when you get like a 0 TSH. I never have seen that, no matter what
Yeah.
you do
Yeah.
with a thyroid support naturally.
Yeah. Yeah. And you can always do all the other additional stuff you mentioned alongside with the Synthroid medication, right? You could do
Yeah.
it together.
Yes. Oh,
Um, Amazing. Okay, so I just want to remind everyone that we will have a post webinar survey link that will be sent out. So if there's anything that we missed, if there's any other topics, if you have any other questions, once again, you can do that by filling out the survey, or you can just email us at info@nutrichem.com if you have any other follow-up questions. that we might not have been able to get to today. So thank you so much, everybody. And thank you, Kent, for that great talk. Thank you. All right, we are signing off. Fantastic. Thank you so much. Thank you for all the feedback.
Hey,
It's great. What do you think? Oh, you're still on it?
yeah, just looking at all these, I mean, every one of these questions are kind of,
They're similar, yeah.
Yeah.
So that's why I said I hit a bunch of them and the main ones. And then because we're sending out the recording data, we can't have it be like hour and a half long. So,
yeah, that's okay.
but that's why I said follow up if you have questions. I also, there was a question and answer. So I got all the ones in there for you.
Yeah, no.